Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh. My name is Navneet Singh. I am a part of the Sikh Heritage Month organization here in Ontario. Thank you so much for joining our talk today. Please visit sikhheritagemonth.ca for more programming for the month of April. This weekend we have our Sikh Fest, so please make sure you guys register for all the events if you can, and show support and learn. And from here, I'll pass it to Ripu to introduce himself today.
Sure. Thanks so much, Navneet. Thanks so much to the Sikh Heritage Month Committee for inviting me to be a part of this conversation today. My name is Dr. Ripudaman Singh Minhas. I'm a developmental pediatrician at St. Michael's Hospital, Unity Health, Toronto. And so as a part of that, I'm also an assistant professor in the Faculty of Medicine at the University of Toronto. And I guess what that means when I say I'm a developmental pediatrician is that I work with children where there may be concerns around their development, their behavior, there may be concern for possible disability. I think taking a bigger picture sort of view, I help families try to understand their children a bit better. So if there are concerns with impairments in certain skills, including speech, motor delays, difficulties with behavior, self-regulation, difficulties with school problems and performance as well, then my job is to, I think, to help families get to know their kids a bit better in terms of what their brain's capacity is, what their skills are. Sometimes if there is a specific name or diagnosis that goes with the pattern of difficulties that we're seeing, and then looking at how to support them and trying to maximize that developmental potential. So that's my clinical work that I do. And through St. Mike's, it is based in Toronto's inner city. So I see a lot of newcomer families. I see families that have been impacted by multi-generational trauma or poverty within the city as well. And then we have some outreach clinics where I work with families who may be substance using in pregnancy, who may be we have a clinic also through the Toronto District School Board where we work with inner city schools with kids who may be struggling or having difficulty as well. So I get to meet lots of families with a lot of complexity, and hand in hand with that is children with a lot of complexity. And then in terms of the research work that I do or the advocacy work that I do, a lot of that is around supporting parents from various backgrounds in their parenting skills and the decisions that they make around how they run their households, how they support their children with their development as well. And so we have two main projects as a part of that. One is a program we call the Maple Circle, which is for families of refugee background to Canada. So we're creating an online parenting support program for them. And then one of our more recent projects, which I think we're going to be talking about in more detail now, is Punjabi Kids Health. So that has been really active over the last couple of months and is really near and dear to my heart as well. So that's kind of me in a large nutshell. I'm also, of course, I'm Sikh and I'm a parent, and that adds richness, I think, to the work that I do as well.
Perfect. Thank you for that very amazing introduction. So you mentioned Punjabi Kids Health. So let's jump right into it. What is Punjabi Kids Health? And then, what was your motivation to start this group?
So Punjabi Kids Health is at this point, it's an online health literacy program. It is community driven and looks at health literacy, health promotion. We're trying to improve access to evidence-based health information for families and children and youth. And also, frankly, for professionals that work with Punjabi families as well. It is information that, like I said, is evidence-based. We try to share information from regulated health professionals. So far it has been folks that are physicians, psychologists, therapists, dietitians. So we've been sharing information in that sort of way so far. And the idea there is really trying to bring that information, that evidence, that science, the medicine that exists to families in a way that really honors the strengths and experiences of the Punjabi community. We know that the decisions we make as parents are very much influenced by our culture, our faith, very much by how we were raised in our own families of origin or our households when we were younger. And so trying to take a look at how do we take the science that exists and apply it so it's something that we can leverage and build on in terms of our strengths as a community as well.
Mhm.
Your second part of the question, Aneet, I think was around kind of the motivation, right?
Mhm.
And so part of the motivation I think this is something that's been in the works or in our minds for our team, I would say for months, if not years. I felt that there was a need for us to have a resource that is specific to the Punjabi experience as parents and as families. And it's funny when we talk to people in the community, and as we've been starting to expand with some of our work, a lot of grandparents now are saying, hey, you know what, we wish we had this when we were parenting, so a generation ago. So social media has really allowed us to open this up in this way. But part of the motivation is really, again, bringing information that exists around healthcare, around parenting, around behavior, school, all that sort of stuff in a way that makes sense to families in the way that we live our lives in a Punjabi sort of household and cultural sort of framework. But we also know that much of what does exist out there to support parents is based on white cultural frameworks around how households should run, what expectations of children should be. And that's something that we're studying with our research group, but I think globally we're starting to get a better understanding of the need for equity in this way and really meeting people where they're at. I think there are many studies that show that health outcomes are much better when you are receiving health information from someone that looks like you, that shares your health experience as well, or your life experience as well. And that can help you with setting some goals around that. And so although we're not providing direct clinical service here through Punjabi Kids Health, we're trying to do in a way that makes sense for families. And some of what we've experienced already is it's not just translation. So we do both English and Punjabi content online, but even the English language content is culturally adapted. So some of it is, we ran some information earlier about virtual school and how to support your children with virtual school. And some of the questions that came back, very rightly so, were around, well, how do we support if we live in a multi-generational household where parents are working during the day and grandparents are trying to support their grandkids with virtual school? Or kind of looking at who makes the decisions in a household, or are these things that are in keeping with our cultural or religious beliefs as well? And how are they impacted by our experiences as children? So for many of the people as a part of this online community, may have had experiences where they were newcomers in a different country, or they were parents and they were working really hard, and that changes how we parent things, right? When you see your parents' experiences, so particularly if they were trying to navigate challenges around resettlement themselves, like language, economics, etc. And so some of what we would have brought with us if we were still living in Punjab in our bins, right? And the collective sort of piece there has gotten fragmented along the way. And so some of that is trying to create, in truth, an online community that helps to support and share lessons around that as well. So like I was saying, the motivation here was really to recreate something, but now in a social pandemic-proof way that allows parents to ask questions, share their own lessons learned as well, and to kind of share in this parenting journey together.
Okay, perfect. So you mentioned virtual school, which kind of ties into my next question. What are ways you think children are impacted by this pandemic?
So so many ways.
Loaded question, yeah.
So, and especially right now in Ontario, as we're going into another lockdown with school closures as well, that are maybe prolonged. So the way that children have been impacted is different from adults, right? We know that the actual infectious disease symptoms are very different for kids, although we think that kids generally are less likely to get sick from COVID and less likely to get particularly seriously ill or die from it if they're otherwise healthy. The challenges we're seeing are along really the non-infectious repercussions of the pandemic, and it differs by age and stage, by family as well. But school, for example, is such a hallmark foundation of childhood and a part of this shared experience. And so when you have, who would have ever thought a year and a half ago, right, that school would be like this? Yeah. And so there have been a lot of challenges. So we do see patients who are having challenges with mental health with their children, with struggling in school, struggling with online school. But then in the bigger picture, this worry about, whenever we do go back to in-person school, is there going to be a different gap there compared to other children? And I think particularly for families where if language is a difficult accessibility factor, if there are challenges with parents having gone through a different education system themselves and knowing really what are reasonable expectations of when we're doing virtual school, or like really what is that supposed to be like. Being able to connect with teachers can be hard for families as well, again, both in terms of language and even power dynamics as well. So school has very much been a challenge, and kind of the mental health difficulties with it. We often talk about the social impact on grown-ups. And I think there is an awareness of how this is impacting children as well, but that's another piece that's been really tricky, both for older children and then also for younger children as well, which I can talk about the younger kids in a bit too. But and then the other thing we've been seeing is generally not specific to our community in particular, but there has been an increase in concern around child harm, where there have been increased referrals and concerns to child protection services or children's aid societies across North America have been seen, where children are, for some children, school is a safe place. It's also a bit of a break for parents. And so for families that are in close quarters for long periods of time, it can be stressful. And some strategies, and parents may have difficulty in implementing those strategies around regulating themselves, being able to manage their children's behavior as well. And then we've actually also seen accidental injuries as well increase. So kids being at home more has allowed them then to get into more trouble at home, which has included sometimes getting into parents' medications. There's been an increase in poisonings, and then also injuries like burns and things at home as well during hours when they would have otherwise been at school and been supervised and occupied in that way. It's a range of different things. And then, like I was saying, for younger kids, it's different. I've got some kids that both in terms of my clinical practice and within our extended family as well, who were born during the pandemic. And what they know is masks and face shields and distance and hand sanitizer. And we've got a lot that we don't know about those long-term repercussions of what that's going to look like. I think a lot of parents have been asking around what do we do for those kids who are growing up in this zone that's so unusual and isolated. And I think it comes back to when we're especially around social development for younger children and certainly older children, but the key relationships we really want to make sure are intact are those that are within your household. So particularly parent relationships, or what we call an attachment figure, that key caregiver for a child. That's where children really figure out, is this what relationships are like? Where do I fit in? What is my value? Where do I fit into the community as a whole? So if we can maintain those, we can support families in really building strong attachment relationships, particularly for our little ones, but then certainly for our older kids and youth as well. It gives them the chance to really maintain their own mental health, and also be able to apply those relationship skills to other places afterwards when the pandemic opens up and allows us to be able to connect again with peers and others as well.
Yeah. So you briefly touched on my next question, but what are ways families, teachers, or parents, what are ways they can support students or their children during this tough time?
So part of it, I think, really is honesty. And of course, that has to be in a developmentally appropriate way, depending on the age and stage and level of each child. But it's all around us. So kids very much know about the pandemic. They know the lingo, right, around corona and isolation and social distancing and whatnot. And so I think it's really important to be honest, to also model how you're coping with it as well. So if that does mean, and that I think forces us as parents maybe to check ourselves a little bit around that as well, because that's how kids are learning to regulate themselves, is by watching us rather than necessarily what we say. So I think some of that is maybe making space for conversation around that. And for kids for whom it may be hard to talk about what's bothering you, or really what's on your mind, or how do you feel about school being closed, etc. It's sometimes helpful to just have shared space to express ourselves in other ways. And sometimes, especially for our younger kids, certainly older ones as well, it's through art. So having crayons and paper available and just taking a few minutes, maybe before a meal or before bedtime, and saying, you know what, we're just going to put on some sort of, either you can put on like Bach or Simran, or you can put on some calming music otherwise, and just say, we're just going to take a 5 minutes, 7 minutes to draw or to color. And then afterwards, we'll get the room quiet again, and then let's share what we saw and see if that comes up with conversation points as well. So I think it's forcing parents and families and teachers to be a little bit more creative in how we make space for this expression of what kids are certainly going through and experiencing. But again, yeah, making space for those conversations at home. And I think a lot of families are, feeling sick of it themselves, even the grownups, like it's been going on for such a long time. And I think that's okay too, to just acknowledge and say, you know what, I didn't think that now here we are getting ready for summer holidays again, or whatever, or here's Vaisakhi again, right? And we are not able to celebrate with our Sangat. We're not able to celebrate with our family as we would have before. And for me, that's frustrating. And just being able to say that out loud and being able to model it for kids, because I think that's the tricky part, is if they don't get it out in their words, it comes out in behavior, it comes out in their body with hitting, yelling, biting for our younger kids as well. And so if we can give them those words. So for younger kids, even just the simple ones like I'm mad, sad, or happy is a good place to start. And then for older kids, using more sophisticated words, if that helps to describe their feelings better, can help. So I think one big piece is just acknowledging it, looking at what you're going through together as well. And then also, I think something all grownups have been going through as a part of this is really, what is the routine? Things have been reset, but we know kids need normalcy. They need routine, even if it is a different routine from before. And so sometimes that does mean on the fridge putting up a visual schedule or a schedule of this is what the day is going to be like. And especially for virtual school days, which are kind of crummy. Like if you think about how grownups get zoomed out in the same sort of way, to expect kids to do a full day of online school and then do homework or extracurriculars online afterwards, or whatever it might be. I think it's important to think about what's reasonable. And sometimes that may mean, we don't get all of the schoolwork done. And it's important to talk to teachers about that and say, you know what, this is a lot of stuff for us to handle right now. Can we should we do all of it? Should we focus on specific parts, or should we look at an extension where we can get back to you afterwards as well? Because we're all professionals and parents, we're all trying to figure this out together. And then I think building into the routine also times for exercise. It has such a huge impact on mood and ability to concentrate. And if there's a way depending on who's in your household, so if it's multiple kids, if they can do it together, if it is with a parent, that's what we had happening here. I have a 9-year-old son, and 10 minutes before I came on this call, I was shot in the face with a Nerf gun. So I may have a little bit of swelling there, but trying to find that time where you can be together as a part of that activity, where it's physical activity, it's a downtime as well. And like I said, that attachment relationship. So with everything else that's going on, how is your family going to come out of this pandemic intact and with strong bonds together as well?
Yeah, no, I love how you mentioned acknowledging how we feel, because I feel like often we just push things under the rug, and then we don't know how to deal with it, right? So if parents are acknowledging how they feel, then they can then put it into words and communicate it to the little ones or their teenagers. I feel like that's going to go a long way. But so my second question, just tying down to that, what's your advice for kids, regardless of their age, how to deal with this pandemic, the fear of isolation, the fear of being at home? Because school's been an escape, right? Regardless of what age you are in, school is an escape. We do hate going to school, but at the same time, we also love going to school, right? So it's just like, what's your advice for kids?
Yeah, so for children themselves, it depends on the age. But when I talk to kids, I ask them really, like, what's the feeling? Like, what is it that you're missing? So is it a feeling of, I miss being able to see my friends. I miss being able to be on the soccer team. Yeah. And so part of it is really, it's a crummy time. It's a frustrating time. Acknowledge all of that. But what is the part that's missing? Or something that I use in my practices a lot, which I think parents can sometimes use as well, is if you had 3 wishes, what would they be? And that really helps to clear up those thoughts of where we're just so bogged down with frustration and the feelings part. But really, what is it underneath that you really wished you could have? Is it that I really wish that I could see my friend who I haven't seen in a long time.
Mhm.
And is that something that works with your public health recommendations at that time? Like, could you do a
Yeah.
backyard visit or a distance visit or an online games night or
Mhm.
something like that? So there is that connection still. Or is it feelings of, fear? Like, I'm worried about someone getting sick, or we have so many. That's another thing that a lot of kids have been dealing with within our community, is this communal sorrow, right? The Punjabi community has been really hit hard by COVID. A lot of kids that I know have grappled with the loss of someone they know,
Mhm.
or someone getting very sick with it. And then
Mhm.
we've also got, with the nature of our community and the role that we play within the Canadian landscape
Mhm.
as well, it has impacted people who work in the service industry, who work in jobs that have been impacted by the pandemic
Mhm.
as well. So there's this communal stress. And then, of course, everything that's going on with the Kazans right now as
Yeah.
well, right? And so, like, there's this kind of blow after blow in terms of how our community is dealing, and like I was saying, that mirrors and what our children are experiencing as a part of it as well. And so I think for kids, looking at really what is the feeling, and with that, is there something you can do to either alleviate that feeling, or with something that is larger? So if the worry is about how COVID is impacting the world or the country, or how it's impacting, because there's kids who worry about, why are people losing their jobs because of this, or what's happening with the Kazans in
Mhm.
India right now, and how does that tie in with me? Is there something that you can do with your child which helps them feel like they have some control over it? So
Mhm.
is it fundraising? Is it doing a presentation to your class about it, so you're raising awareness, or like I was saying, raising funds for a charity that helps with that as well? Is it helping out a neighbor or someone else, and just doing something very concrete and real, which makes them feel like they're a part of something? So to kids, I would say really just think about, what is it that you're missing?
Mhm.
Because it can feel like everything's changing, but if there are a few key pieces there that you can work to restore as a family, even if it's short-lived, then I think that really, really goes a long way.
Perfect. I see a really good question in the queue. I was going to wait till the end, but I'll ask now. Because of the pandemic, everyone's home, right? We're forced to be at home, regardless of whatever we used to do to go out. And that's taken a toll on people's mental health, right? So what do you suggest? What are some best practices to keep everyone's mental health in check and healthy, whether that's parents or kids?
Yeah, that's a great question. I think that'll probably evolve and change for all of us depending on where we're at, both with the pandemic and all of the stressors around us.
Mhm.
Um, but I think some of it is what I was saying earlier about normalcy and routines. So the things that make us feel better are generally sleep,
Mhm.
exercise, eating healthy, and
Mhm.
connecting with people. And so I think if we start with those, and with times when you have virtual school, or if you're working from home, it's very easy to slip into um, Netflix binge watching and staying up late, or eating junk food, having snacks kind of
Mhm.
willy-nilly throughout the house as well. Like, especially when kids are doing virtual school, it's so easy for them to just go grab something from the pantry as well. So I think looking at, really, if you just kind of keep those foundations in place, then that's a good start for parental mental health. Hopefully also the mirror of that in terms of children's mental health as well. And if
Mhm.
there are bigger concerns, I would say reach out to your healthcare professional, reach out to the mental health professionals that exist out there within your community as well, for if that's something that, as a grown-up, would be a benefit to you. These are really tough times, and I think it's important, again, to acknowledge when there might be a need. Um, Even honestly, like I was saying, that connection with other people has become so hard, where we would otherwise talk with people as a part of our sangat, right? If in the Langar Hall or wherever else. And those are just organic ways as humans that we've evolved, that help us with managing our sorrows, our challenges, all of those sorts of things, where now it's harder. You have to almost set up like a Zoom call with somebody
Mhm.
to just kind of, you know,
Yeah.
talk.
Mhm.
And so it's very isolating. And so I think looking at those things for yourself as a parent will really help. But again, just taking care of your physical health often flows through into your mental health as
Mhm.
well.
Yeah, no, no, for sure. And then what are your thoughts slash advice for multi-generational homes, where kids are being co-parented by multiple adults, their parents or grandparents, and so on?
Yeah, it is. That's tricky, and it depends on what the challenge is, right? And kids kids learn very quickly And I say this both as a joke, but also in terms of real life, the kids learn very quickly what they can get away with whom. And so if it is that the nanny is going to give you gulab jamuns for breakfast, and that's based on a true story with my lived experience. So if that's the case, then you have to have some conversations around that. But I think specifically with grandparents, I think especially, I mean, so many grandparents are really well-intentioned, want to be able to help, want to be able to connect. So if there are ways to protect that time where, you know, it's time for grandparents and grandkids to have some time together, whether that's a meal or whether it's a walk or something like that, that might be one way to look at it as well. And then also if there's a way to differentiate some of those roles of who does what or who does what when on certain days, might help as well. So, I mean, the multi-generational piece had so much richness to it, but then also you have to think a little bit about how does that work in terms of parenting with kind of multiple cooks in the kitchen as well. And I think a lot of it is with the grandparents that I know, a lot of it is just clarifying really. So when you do have that time with your grandchild, what are the things that would be helpful? So if it is a meal, if it is helping with math work or logging into virtual school, whatever it is, in a way, so that it is something that is a part of the overall parenting plan. And I hesitate to use the word parenting so much because it implies this very traditional sort of European model of a male and female parent kind of living in one household and raising children. But the idea really is when you think about a caregiving plan for children, what are the roles and what are the strengths of the different people that are part of that child's team that can really help move them forward. I hope that helps to answer the question.
No, for sure. And that kind of ties into my next question, which is raising bilingual kids. Right? It's like, what does research say about long-term impacts of learning two languages over a very, very long time?
Yeah, these are great questions. And I'm going to plug again Punjabi Kids Health just because we're covering a lot of this stuff here. So on Instagram, Facebook, at Punjabi Kids Health, you can follow us there. And then also because it's community driven, you can put in your questions there. And as we make our curriculum of what we're covering in the weeks ahead, we'll be trying to respond to the needs of what the community themselves are saying. It's kind of funny, before I answer the question, we were talking about kind of the numbers of how many followers we have. And that's I don't like that term, particularly because we want to be community driven. The idea is really, I mean, our team is the follower. So as a part of the overall community, we're hoping for the online community to ask these sorts of questions to help us with moving forward. So around bilingualism, May is Speech and Language Month. So we'll be having a lot of content then around kids with speech delays, bilingualism, and how that is a part of the brain. And then also we always add in the multi-generational piece as well, because it's so real and impactful for families. But when we think about bilingualism overall, it's great. It's great for the developing brain. It's great also in the research that our group has done. We found for kids who have disabilities as well. So even if you're behind in your speech, even if your child has attention deficit hyperactivity disorder, ADHD, or autism, there's still a great amount of stimulation that happens in the brain when you have more than one language. The tips, though, that we give to our patients, and some of these are also from our colleagues who are speech language pathologists in multilingual communities as well, is to help that child figure out really which language to use with whom. So what are the social circumstances? And then also trying to, again, very practically, try to use one sentence in one language. So it's not the, can you give me the Barney? Right? Because then I think when we think about many people that are multilingual, English and Punjabi for us often kind of flows back and forth. So helping kids, particularly in the first few years, to do the whole sentence in one language. So whether it is Punjabi, whether it's English, whether you're going to do the same one twice is okay too. So you could kind of say, "Mainu paani de de," and also like, give me the water. And some families like to do that almost like a subtitle of itself. That's okay too, but really as long as it's together. If you want to, let's say if you're in a household for example, that is primarily English speaking, but you want your children to be bilingual, or you're trying your best to be bilingual at home and it's just not working. Most kids tend to pick up English more so in most parts of Canada because we're English speaking at school. Then I would still stay true to your intentions there. I would still expose them daily to Punjabi. So whether that is in your daily routines, whether it's in path or ardas, whether it's in breakfast, lunch, whether it's in bath time, whatever it is, kind of decide as a parenting team or a caregiving team with your around really what is the routine that we're going to make sure is always in Punjabi every day.
Okay.
And that way, because we know really within the first 6 to 9 months of life, so before your first birthday, your brain is already starting to lose some of the language plasticity that you have. So the ability to differentiate between different sounds in your ear and even with the way that you speak. Okay. If for kids who have not heard those sounds, and again, in Punjabi, we have so much richness to even the nuances of certain sounds and emphasis, right? And so with that, you really want to make sure that they're hearing it. And if possible, saying parts of it. So then they keep that. And so I would say a lot of families say we're going to do whatever sort of religious practices they're going to hear regularly, whether it's daily or not. Maybe meal times or bath times or bedtimes are easy. You can kind of choose, and then use the same words as a part of that mostly, right? So, so with food, it's often the same sorts of words and practices that come up. So kids get used to hearing that. And at some point, and it's usually around kind of the 9 to mid-teen year old, kind of 9 to 14, 15-year-old mark, when kids are then going through a phase around defining their self-identity and looking at that's where there's this awareness sometimes around, you know what, I may be English speaking, but I'm a part of this larger community and this is a part of who I am. And then they've already got the linguistic skills. So between their tongue and their ear to be able to differentiate between different sounds. Hopefully they'll have a little bit less of an English accent then as a part of that as well. And then you just build up a ladder. So you've got your English, and then they start kind of looking at what are the words whenever they're ready that parallel those as well. So they may still think in one language, but be able to translate that as well. So overall, I mean, this is an area of passion for me. I love it. But overall, we think that bilingualism is great and certainly something that the family should try for. For English-speaking parents who are ethnically Punjabi and they want to have more Punjabi as a part of their life, there are some great apps out there. There's also great online sangats and communities which do instruction in different parts of the country where then you're exposed to it. So it's not all the onus being on you as a parent, especially isolated during the pandemic, but being able to access some of those great resources that are out there as well.
Okay, no, perfect. And then my last question, kind of moving it back to Punjabi Kids Health. What programs or outlets does Punjabi Kids Health offer for parents, families, or kids?
Yeah, so right now we are on our most active social media channel is on Instagram. We also are on TikTok and Facebook as well. But at this point, like I was saying, we're not doing clinical services. It is a health promotion kind of space for conversation, for people to share their lessons, to learn, to be able to help guide our conversation as well. So this week we were talking about kind of GI health or tummy health. So we polled our followers, and actually one of the biggest questions that came up was around constipation in kids. And so that's something that we're covering for now. We'll talk about celiac disease and a few other things as well this week. So a lot of it is, again, responding to the needs of the community. And we're hoping in the months ahead to create a community advisory council with people from various parts of really the global diaspora in terms of the followers that we have as a part of the Punjabi community to help us with that. So it's, like I said, online sharing information. We're trying also, we've been talking about whether we would have more streams of information. So whether there's something that's specific more so for moms or female caregivers, or and then a specific stream of programming also online for dads or male caregivers. Grandparents certainly has come up quite a bit as well. And then also similar to your question that you asked Navneet earlier, it reminded me of that. We were thinking also about more child-specific or youth-specific programming where so many kids and youth themselves have questions as well.
Yeah.
So we're trying to create a space for some of that as well. So again, it's information sharing, trying to connect within the immense resource and knowledge within the Punjabi community with the professionals that we have and the experiences that people have, and trying to connect it in a way that works for people.
No.
Sorry, I have a question. I just can't put it in the chat because I'm a panelist. But if you don't mind, they're related to actually COVID. So there's two of them. One is that a lot of families that I'm hearing, typically Punjabi or Sikh families, like we live in extended families. So you have grandparents, sometimes you even have aunts and uncles, like chache, mummy, you have kids, everything. What happens when someone, like how do you quarantine in an extended family? What's the best way for someone to do that? Because I haven't experienced it personally, but I know of families that are going through it, and it's really difficult for them, especially when they have like really little kids, and then your moms and the kids have to be separated. And the kind of follow up to that, related, unrelated, is we were talking, the three of us, just before this started, about the vaccine and your naniji, and talking to her about getting it, just vaccine hesitancy. So if someone is having doubts or they're not sure, what's the best way to try to convince them that it is really in their best interest and in the best interest of the community to get a vaccine?
Sure. Two great and relevant questions. So around quarantining within a household, really tricky. Again, it depends on what the household looks like. So if it is a space where you've got like a suite that works, so whether it's a basement or an apartment sort of within the household, then that makes it a bit logistically easier. Or if it's someone within the same household, like within a bedroom to themselves, that makes it easier in terms of day-to-day. How does that impact children? I think, again, being honest about it, I think is so important. So I think we sometimes get into the conversation like earlier around not being truthful or hiding things. But I think just saying, like, Mummy just had this test done. We need to wait for the results to come back. So in the meantime, you and I are going to be spending lots of time together. We're going to do these other sorts of things. We're going to wave to Mummy from a distance, especially if it's possible to do it outdoors where you can have a bit of a distance, especially if the person's not symptomatic, or if it's a grandparent, kind of doing that in a way that works. So that's one thing, is just looking at the logistics. And I think involving children in those routines. So if the child is old enough to help with, this person is now having to stay within their room, they're kind of bored there. Is there something fun we could do for them? Could we make them a card? Could we write them a letter? Could you help me with preparing foods or a special treat for them as well? So again, that feeling of, as a child, this is scary and feels out of control. Is there a place where I can kind of reinitiate some of that control by being able to do something helpful? I think is one way to look at that. Aside from all of that, when we're looking at young children and it's their mom or their primary caregiver, that's really scary and difficult, right? And so I think that's a space where you have to weigh out the risks and benefits. So if it is a breastfeeding mom in particular, the recommendation generally has been that the child should still be with mom. And during that time, we just try to maintain hand sanitizing and mask during that time as well, during the time that the child is actually feeding. But it is really tricky. There's some great resources on this actually online at, there's a group called the South Asian COVID Task Force. And so their Instagram page and their Facebook page has a lot of information, multiple languages, including English and Punjabi, for how to make this work in real life at home. Luckily, I think we're at a point now where COVID tests are coming back faster. So some of that quarantining until you wait for a result to come back is a bit shorter, and it's a little less scary. The other thing that's nice is because the weather's a bit nicer now, some of that time in between can be spent with children outside as well, rather than being kind of inside in the same household during that time can really be really confusing for kids, I think. The second question, Sandy, was around COVID vaccines, right?
Vaccine hesitancy, like whether it's in younger people, older people, just in general, some kind of like a little bit of advice as to how we can convince people to go ahead and get their vaccine.
Yeah, so on our website, on our Instagram page, we have a couple of videos up around the COVID vaccine, if that's helpful. So we polled the online community around questions people had. So some of these things were around, is it safe for breastfeeding moms? Does it impact fertility? What are the age cutoffs, etc. And so generally, I mean, in one sentence, I would say the side effects of the COVID vaccine are way better than getting COVID itself. And so I think that sometimes helps people to realize a little bit of really how dire the situation is. Lots of people within the community, I think, from conversations I've been in a part of, have been feeling, you know, I haven't gotten it yet. So if everybody else is getting vaccinated, really, do I need to get vaccinated too? And particularly with the variants and the increasing severity of some of the illness, I would say very much yes. And the other part of it is also currently we're in this ICU crisis where even if you were to get sick, I mean, there may be no place for you to get really the care that you're thinking you might get as well, because our resources are just so strapped. So I would say if any of the vaccines is available to you right now, I would get it. And I know there's a question around almost like we were discussing, it's kind of like a brand name comparison around like, did you get Pfizer? Did you get this? Did you get this? And so with that, we consider all of them to be effective at keeping you from severe illness and death. Some people may still be symptomatic and get some symptoms from it. But if you have questions about that, talk to your doctor, check out these amazing resources online as well. But generally, again, side effects of the vaccine are way better than actually getting sick and passing it on to a loved one as well, and kind of really having to cope with what the repercussions of that might be.
Thank you. I appreciate you answering that. Sorry, Nami, back to you.
Sorry, I was on mute. My apologies. No, great question. I see another question in the chat. It's from a mom. She said that her 10-year-old son is sometimes a little too stubborn to handle and just doesn't want to acknowledge that he could be wrong. How can she handle this situation?
Yeah, that's tricky. And it's funny to think about really what is underlying there. And so, of course, I'm going to have to give you more of a general answer because I don't know the child, I don't know the parent and the dynamic there. But it's important also to think a little bit about what is that characteristic or what is that quality. So when we think about our children and where we want them to be when they're older, we want them to be determined and leaders, and we want them to be strong. And at the same time, as parents of a child with those features, it can be really inconvenient. It can take a lot of time to parent and to engage in these conversations. And so I wonder what this stubbornness, as mom is perceiving this, is. So I think with a lot of these things, as I was saying earlier, it's around giving kids the tools to regulate some of those feelings, to understand and process them as well. So is it in situations, so is it around situations where there's a loss of control? Is it something that is they have a fear of? And so every behavior that we do as grownups, as children, has a meaning behind it. And it's not that that a child is inherently, of course, bad or being argumentative just for the sake of that, but really what is, again, underlying that? So is this a way to connect with you? Is it attention-seeking behavior? Maybe. I mean, really, again, thinking about what's going on behind there and what is the message the child is trying to give you. And so I think sometimes that's a good place to pause if you're in this sort of discussion with a child, is especially a 10-year-old, I can kind of imagine pausing and taking a second for yourself as a parent, because these dynamics over a decade of the child's life have probably evolved as well and gotten you to this point, to actually stop, take yourself out of this cycle, especially if you're getting upset. Take a deep breath, maybe leave the room and tell him, just say, Mommy needs some time to think about this. I'm feeling really upset right now. I need a break. I'm going to come back and then we'll talk about it. Doing that and then coming back, as long as the child is safe, of course, and then having a bit of a conversation and trying to say, you know what, you were saying you didn't want to do this, or you didn't want to stop doing this, for example. Can you tell me a little bit more about why? And trying to get to the why part is really going to help open up space for conversations. And I think being very careful with how we label, and I think that's something culturally that exists. I think also it's just sometimes easier in terms of language to say that a child is, they're having stubborn behavior. So to label the behavior, not the child. So you're not stubborn. this behavior was stubborn, this behavior was very self-directed. I felt like you were thinking really a lot about your feelings here. Can we pause and talk about really how this is impacting everybody else as well? So I would say to the person that asked that question, it's going to take a little bit of detective work to really figure out what is the underlying, what is this child hoping for? For most kids, the currency really is connection, right? So most of them are doing whatever they're doing because they, or really their preferred activity would be able to spend that time with you. So when we go back to the earlier questions about how do we get through this pandemic, some of it is being able to say, we've all been on our Zooms for the day, we've all been on our phones or whatever. Can we just unplug for a while? Even if it's, we say Friday night dinner, Sunday morning breakfast, like just, can we take a bit of a break at this structured time and just play, go for a walk, do all of these organic things that really help just to build strong families and connections as well, and to help us understand each other as well. I think the other thing I'll say for that person is there are some great resources online. So we covered some stuff on strategies on Punjabi Kids Health on how to support your children with behaviors that might be troubling. And then also there are some other resources online, like there's a group called Triple P Parenting. So it's the Positive Parenting Program, Triple P. And so they have some great resources online and a parenting troubleshooting guide in English as well that you could take a look at.
Okay, no, perfect. Thank you for that. And the last question that I kind of relate to as well, is the Punjabi population greater predisposed to thalassemia? And where does one get genetic counseling? Because I have thalassemia as well, and so does my dad. So yeah.
Yeah, so yeah, that's a really good question. So we do see it higher within certain racialized communities, and South Asians are a group where we see higher kind of carrier rates and risk of thalassemia. So if you're concerned, so if you're a carrier, or I guess the concern around counseling, usually when you would access genetic counseling, if you're thinking of having a family or if you're pregnant at that time. So you could talk to your primary care team about access to a genetic counselor. So they have them in different parts of the country. It should be covered by your provincial healthcare plan. And then it helps to give you some information really on what are the risks, and especially around percentiles and proportions as well, if that helps.
Okay, no, perfect. Thank you so much. So I don't see any other questions. So Ripu, if you had any closing remarks before we say goodbye.
Yeah, nothing else. I think at this point, just thank you so much for making space for this conversation. And also, I think part of our intention behind creating Punjabi Kids Health was just, I think within the Punjabi community, we just have such a value for our kids, right? That it's a community where like our families are families. We're multi-generational. We value our children as our future, and even in terms of their inherent value as well. So we really wanted to make sure that parents have the tools, space to ask these sorts of questions, which are very real, which sometimes are hard to ask in terms of your actual primary caregiver, especially if they don't look like you, or if you don't feel like you have that time as well. So that's part of why we're here. We welcome people to follow and kind of help us with guiding what conversations come from it as well. And thank you so much for having me today.
No, thank you so much. On behalf of the Heritage Month, thank you so much for taking the time out, having this discussion with us. It's been great. But yeah, thank you. Variguji Ka Khalsa, Variguji